It may be too early to declare the global end of the COVID-19 pandemic emergency because of a potentially devastating wave that has gripped China, according to several leading scientists and advisors to the World Health Organization. Yes, this is the big disturbing news that is coming in right now. As per a report in The Guardian, the views of these scientists represent a shift since China began to dismantle its zero COVID policy last week after a spike in the infections and unprecedented public protest. Projections have suggested that China, the world's second largest economy, could face more than 1 million deaths in 2023 after the abrupt change in course in the country where COVID-19 was first detected at the end of 2019. I'm not saying this has been reported in The Guardian. China's zero COVID policy kept infections and deaths comparatively low among its population of 1.4 billion, but a relaxation in rules has changed the global picture as per the experts. There were a lot of protests in China because they were having such stringent precautions for such a long time. Now the question is whether you can call it the post-pandemic when such a significant part of the world is actually just entering its second wave, asked Dutch virologist Marion Koopmans, who sits on a WHO committee tasked with advising on the status of COVID-19 emergency. Alongside the risk for China, some global health figures have warned that allowing the virus to spread domestically could also give it the chance to mutate, potentially creating a dangerous new variant. It's clear that we are in a very different phase of the pandemic, but in my mind, that pandemic wave in China is a wild card. Koopmans is saying this, not me again. In fact, as recently as September, the WHO chief Tedros Adhanom Ghebreyesus had said the end is in sight for the pandemic. In fact, last week he told reporters in Geneva that he was hopeful of an end to the emergency sometime in 2023. Now, most countries, as you know, have removed COVID-19 restrictions as threats of dangerous new variants of the virus or a resurgence of infections subsided quite a bit in the second half of 2022. It was almost like it's nil. The WHO chief's earlier comments, however, fueled hopes that it could soon remove the highest alert level for COVID, which has been in place since January 2020. I know a lot of you don't feel it, but it's still there. Koopmans and other WHO advisory committee members are due to make their recommendations to the WHO on the alert level in late January next year. The WHO chief, however, makes the final decision and he's not obliged to follow the committee's recommendation. Did you know on Tuesday itself, cities across China scrambled to install hospital beds and build fever screening clinics as authorities reported 5 more deaths, and international concern grew about China's surprise decision to let the virus run free. Again, I'm not reporting this has already been reported, you can read. At the moment, however, China's data shows that variants circulating there are globally dominant Omicron and its offshoots, although the picture is incomplete due to the lack of full data. The bottom line is, it's not clear the wave in China is variant driven or whether it just represents a breakdown of containment, according to Tom Peacock, a virologist at Imperial College in London. The United States have indicated that it stands ready to assist China with its surging outbreak, warning that an uncontrolled spread may have implications for the global economy once again. America, by the way, says, for us, this is not about politics, this is not about geopolitics. Asked if the US had offered to provide China with vaccines, US State Department spokesperson Ned Price said, I'm not going to go into private discussions, but we've made the point many times publicly that we are the largest donor of COVID-19 vaccines around the world. But interestingly, let me tell you, among the 4 cases of the new BF7 variant of Omicron is of a 61-year-old NRI woman in Vadodara who just returned from the United States. There are 2 cases of this variant in Gujarat and 2 in Odisha as per officially available figures from India. This is the same variant that is responsible for the surge in COVID-19 cases in China, and now it has already reached India. The Union Health Ministry of India, however, says no need to panic as India's vaccination rate is very high. This NRI woman in Vadodara was inoculated with 3 doses of Pfizer vaccine. The woman was kept in home isolation and did not report any major symptoms. The condition of the woman is also normal as per Vadodara civic chief. Now, besides this NRI woman, a man living in Gotha area of Ahmedabad has also tested positive for BF7. According to the civic body, the man came from abroad in September and contracted COVID-19. His sample was sent for genome sequencing and it was found that he has been infected with BF7 variant that's spreading fast in China and becoming a global concern. What are your thoughts on this latest disturbing new development, once again originating from China? Let me know your thoughts in the comment section. You can directly connect with me on Instagram and on Facebook. It's @ReviewRon. It's @Ronak Kotecha on Twitter. Like, share, subscribe, and hit the bell icon if you find our videos worth it. But as always, even if you don't do any of these things, thank you so much for watching this one. Please take care of yourself and those around you. Jai Hind.